Hello, welcome to the Healthy Enterprise Podcast. If you're a return listener, thank you for joining us again. And if it's your first time, welcome. I appreciate you for being here. My guest today is Michele Hart. She is an accomplished senior marketer with 15 plus years of experience driving impactful campaigns for national and global brands, and is currently working in the nonprofit sector as the Director of Marketing and Communications for BostonSight. That is an organization that restores sight for individuals with corneal diseases and dry eyes. This should prove to be insightful. Excuse the pun, but let's have a chat with Michele. Michele, hi, how are you? Thank you for joining me today. I've been looking forward to chatting with you, and welcome to this episode.
Hi, Heath. Thanks for having me.
So why don't you start with doing a little introduction of yourself and tell us about your professional journey and where you've gotten to now.
Sure. So Michele Hart, I'm currently the Director of Marketing and Communications at a nonprofit called BostonSight. I have been in healthcare marketing for about 25 years. And I actually studied anthropology in college and journalism. And
I noticed that. I was looking at that.
Yeah, it's an interesting trajectory. Anthropology has actually been incredibly useful in the marketing field because you're really taught to, pay attention and observe how people behave and interact. So from a marketing perspective, it's highly valuable.
Yeah, no kidding.
And then I went on and got a master's in writing, and I started in a corporate communications company, role that got merged with marketing in this company when I was in my 20s. And that's just how I ended up in marketing. There was no particular rhyme or reason to it.
I think that's how most of us end up accidentally landing in marketing.
Right? So. I know you could have the best laid plans for where you think your career is going to go. And then somehow it just keeps taking these twists and turns. But I really liked it, and that was a for-profit company. But then I moved into nonprofit, and, aside from the obvious things like pay tends to not be as high in nonprofits as for-profits, the mission-based work is really, really meaningful. And so I've been in nonprofit, the majority of my career. And including a stint for about 12 years or so where I ran my own association management business, which was for nonprofits. Yeah, back in the day, there was not quite as much flexibility for mothers or parents, working parents. So at the time, I had to find a way to have more flexibility with my work schedule. And so I started a small business. Again, it was kind of by accident. I had taken 10 months off from my career to be home with my first baby. And somebody asked me to run the marketing and operations for their association. It was a small medical association here in New England. Mm-hmm. I said, sure. And then a board member on that association was a board member on another and asked me to run this other association. And then a board member on that one was a board member on another. And you can see where this is going. And before I knew it, I was an LLC, and I had an employee that worked for me.
Wow.
And I could make my own hours. I was only committed to being on site for particular events. So I don't recommend working with your babies at home, but it gave me the opportunity to create a flexible schedule.
Right. Yeah. That was like a true fractional executive role you had going on there with multiple roles for multiple organizations.
Yeah, exactly.
Yeah, interesting.
Exactly.
And so then what happened after that? Then at what point did you get involved with BostonSight?
Yeah, so when my youngest child went to kindergarten, I really didn't want to be in the association management business. It worked for me. Time, but I didn't want to be dealing with all of the payroll and all the operations part of actually running a business, the financial aspects. So I sold that off, and I actually started working for an autism research organization that's here in the Boston area. And I was there for a couple of years before I moved to BostonSight. And I started in BostonSight in February of 2020, and we can all guess what happened 2 weeks later.
Right.
We were all working from home. um,
Uh,
which, it was challenging, but I will say the benefit to that as a new employee is you really get to know your coworkers very quickly
yeah.
because everybody's we got to know each other's dogs. We got to see everybody's homes, what their spaces looked like.
It
And
got
we became a tight knit team really fast.
it got very familiar very quick, didn't it?
Yeah,
Like there was
exactly.
no going around. Even there was no hiding the person walking past in their underwear. There's just
No,
knowing.
no,
I don't
yeah,
think the backgrounds, I don't even think were even working that well back then, were they?
they weren't. And I had 3 kids at home, all doing remote school, right? One was in elementary. So he's like, the elementary kids are all excited to talk on screen. The high school kids are barely awake. I remember being late to a few meetings because I'm trying to get them all set up and go. And everyone was just wonderful about it. You had to do what you had to do.
It makes me think of that BBC clip where there was somebody speaking a very influential or very
Yes.
an expert in some field, in the door of his office opens and now in comes his toddler, and then his wife crawls in on her hands and
Yeah,
knees and trying to drag the child. Little does she know she's on the back. She's in the background.
that was fantastic.
And that guy
The
just
toddler
kept
comes
on
in,
walking.
just, all business. And then the baby rolls in her little walker. And I was so glad, I was so glad it happened to a man
Yeah,
because
yeah.
what I really discovered during that COVID time was, and not to generalize, but the majority of stay-at-home parents still tend to be mothers.
Hmm.
I think it gave the parents who work out of the home a really good sense of how challenging it is to
Hmm.
raise children,
Yeah,
and to be home with them and try to accomplish anything.
yeah,
They're busy,
exactly.
so.
It is a good example, and for so many people, it became uh, a real true understanding of yourself and how you could manage yourself at home and working. And it's not as easy as it sounds.
Yeah.
And so at some point, we all got to decide, well, do I prefer working at home now, or am I going back to the office? And now we're seeing kind of a little bit of hybrid of everything all over the place. Like some people are working 2 days in the office with the rest of the week at home. And so it seems to be we're a little more fluid as more than we used to be.
Absolutely. And it was hard for me to go back into an office because when I ran my own business, I had my office at home for 10
Hmm.
years, 10 plus years. I did love the impromptu conversations
Yeah,
I would have with folks and
yeah,
walking
they were fun.
around the office. Yeah. So that's good. And now I work hybrid. I work a couple days in the office, a couple days home.
Nice.
And that's perfect. I
And
absolutely love it.
what drew you to BostonSight? Was did you know about the company before you joined them? And
I did not know about them. And they are only about 18 miles or so away from where I live. It's a niche product that we provide, product and medical treatment that I'll talk about in a minute. But what drew me to them was the opportunity. They had not had a communications or a marketing role in,
mm,
gosh, a number of years. So I love coming in to a company and sort of building that marketing function from the ground up, creating all the foundational pieces, auditing all of the materials, taking a look at where they are. And so I was able to do that. It was a really great opportunity. And now that I've been there 5 years, I'm having to sort of shift my mindset a little bit. The foundational stuff is done. So where do we go from here?
right. Good
Yeah.
question. Or
Yeah.
do you? I'm
Right.
sure you're going to answer that.
I will, but well, let me tell you about BostonSight. They've been
Yeah,
around
absolutely.
for over 30 years and originally founded as Boston Foundation for Sight. We have a patent on a scleral lens. So a scleral lens is an oversized, it's a contact lens, but it doesn't touch the cornea. It only touches the white part of your eye, which is called the sclera.
Oh,
It vaults over the cornea. And so it creates this like little bowl where you put solution into it and then place it on the eye. And it improves vision, but it also really reduces pain and discomfort for people with ocular surface disease or corneal disease. We are a small company, about 50 people. But in our location in Needham, we have an on-site medical clinic with optometrists and ophthalmologists. We have an on-site manufacturing lab. We produce more than 40,000 scleral lenses a year out of our little lab. We have an education and research team. And then we also have a commercial scleral lens, which is still nonprofit. Any revenue from that entity goes back into BostonSight, the parent organization, and that funds patient care,
right,
and research.
Oh,
yeah.
Can you spell it? You're saying a squirrel?
Scleral.
Scleral.
Yeah. Rolls off the tongue.
Yeah.
Scleral.
Scleral.
Scleral. Yeah.
Scleral.
Yeah. And
gotta
so
see it to read it.
The white of your eye is the sclera.
See, I did not know that. See, that's why we learn these things. People are going scleral. I've never heard that before. Now, who knew that there was this particular lens? Like, how did this come to be? Is that obviously ocular malfunction of some sort is discovered by an optometrist, more or less, typically? Is that how you determine
pretty
that?
Much. I can't recall off the top of my head the initial person who sort of created this lens, but the purpose is that, so the cornea is the most sensitive part of the human body. And if your cornea, have you ever heard of keratoconus? It's where the cornea kind of bulges out into like a cone shape.
Right.
So the light cannot refract properly on the eye and your vision is distorted. So that's a visual issue, but also as the cornea distorts, it can be uncomfortable. So you cannot put a soft contact lens or a hard contact lens directly on the cornea. It's not going to solve the problem. It could cause a lot of discomfort. So the scleral lens with this fluid reservoir and the preservative-free solution that goes inside it, really, again, it sort of creates a faux cornea, like you're creating a new shape, but the healing properties and the comfort properties are immense. Some of our patients have issues where the inside of their eyelid feels like sandpaper, and you blink.
Oh my God!
I think something like 19,000 times a day. So can you imagine the pain for that? They put a scleral lens in, and it's immediate relief.
Wow. And so that doesn't necessarily have to be a prescription lens. It could be non-prescription, and it's really literally just to protect the eye, protect the eye from the eyelid.
Yeah, so it can protect the eye from the eyelid or environmental debris.
Right.
Occasionally, patients have an eyelid that will not shut, so a scleral lens can protect the eye surface. We've actually also, for ALS patients who are using medications to reduce mucus secretions as they're progressing in their ALS diagnosis, their eyes get very dry. And so we've found that ALS patients can continue to use their eye tracking system for communication longer by using a scleral lens.
Oh, is that right?
It's been really wonderful to see.
And we talked earlier too, you said for stem cell transplant patients who suffer from dry eyes also can take advantage of this as well, right?
Absolutely. We see a lot of ocular GVHD, which is graft versus host disease patients in our clinic. Yeah.
And Sjogren's, I was reading.
Yeah. Yes. Sjogren's.
Yep. And which is not a very common thing, but I know somebody that actually has that, a family member. Yeah. And suffers greatly from dry eye because it's the lack of all secretions, right?
Yep.
Saliva and fluids in the eyes. So very uncomfortable. So these are really amazing solutions for people. And it is really, it's a discomfort thing. Like it's about quality of life. Right.
100%. We surveyed about 2,000 of our patients last year, and the percent of those folks who responded, 96% of them said they had improved quality of life because of their scleral lens. This is our specialty scleral lens. We have two avenues. We have our PROS treatment, which is more for the most challenging cases out there. And that's what we do in our clinic in the Boston area every day. And then our commercial scleral lens, which is BostonSight Scleral, that's used by optometrists worldwide. We're in about 40 countries. It can also be used for more severe treatment, but in that case, it's really practitioner capability. It tends to be used more frequently for folks. I don't want to say less challenging, because to the individual, their condition is challenging. But from a diagnostic perspective, perhaps a little less challenging than what we see every day here in the Boston clinic.
What was the second one again, you said?
Yeah, that's BostonSight Scleral. That word again. BostonSight
Scleral.
That's the commercial lens.
Oh, that's a commercial lens. Okay. Yeah. Interesting. And so how have you, so you came on, so it must have been early days in the company, because you said it's been around for how long?
It's been around for 30 years.
Oh, 30 years.
It was not early days in the company, but early days for getting a marketing function going.
Right. Oh, okay. Right.
Yeah.
And when you arrived there and you come in as the marketing person, what were the challenges that you experienced to get out of the gate?
Yeah.
Because this was then, what year was that then that you came in? It was
2020.
2020. So what kind of challenges did you face when you arrived? COVID aside, obviously that's a big one, but. Yeah.
Well, there were a number of them. Foundationally, the branding was a little bit all over the place. I think the organization was really trying to figure out who they were or are, because of the expansion of the research. Because we partner on clinical trials and such with pharmacological companies, and this commercial product had been being sold for a couple years, but they were really struggling to figure out where the commercial product fit with this treatment model that we did in our clinic, right? Because as the commercial lens continued to become more complex and continued to grow in its capabilities, was that going to eat away at our business for the pros treatment that we do in our clinic?
Right.
So they had to make some really big decisions there. And that was part of what I helped with was, we really needed to own the fact that the PROS treatment, which, by the way, PROS stands for prosthetic replacement of the ocular surface ecosystem.
That was my next question.
Yeah. And again, that's for the most challenging cases. And there's only about 20 doctors in the world who are PROS fellows. We train them. And they're all at tertiary eye care centers, because you have to have an ophthalmologist, you have to have an optometrist that's trained, and you need all of the administrative support that a tertiary eye care hospital can provide. So we have PROS fellows at Johns Hopkins, at Baylor, Weill Cornell Medical Center, out at UCSF, et cetera. And we had to own the fact that this PROS treatment is really for those most challenging cases, because scleral lenses are becoming more available and becoming more widely known. You don't need the most aggressive treatment for somebody who has a less severe case of, for instance, keratoconus or ocular GVHD.
Right.
And there's a financial impact as well to both the patient and the provider.
Yeah.
So the commercial scleral lens really let us scale up the business. The goal is to ensure that people can have access to a scleral lens anywhere in the world. That's what we're trying to accomplish. And, we do a lot of that, not only through the sales of our scleral lens, but education for practitioners and ensuring they know how to fit these lenses.
So the commercial lens, now I'm understanding now. So you're selling business to business in that sense. You're selling directly to ophthalmologists, you said?
Yep, and optometrists.
Optometrists, and they're doing the fitting and the training to the patients and doing the client care.
Exactly.
Directly. Right.
That's exactly right.
And so then you train them to fit the lens and get the lens going. Okay, I get it.
We do a little bit of B2B2C, because not all doctors, not even all optometrists know about scleral lenses. So even having patients advocate for themselves can help drive business, but also it's really about ensuring the patient knows what options exist.
Right. Because if a patient goes to their ophthalmologist or optometrist and says, I heard about this product, that's a great thing.
Yeah.
That's a great for
It
marketing,
is,
because the
it is a good
customers are
thing.
coming to the doctor saying, this is what I want. And that would encourage that doctor to then explore that opportunity
Absolutely.
for, and then are you training them? Are you also helping them market that product on their behalf? Is it that kind of relationship?
We initially tried something like that and found that was challenging. We do provide, anytime we bring a new practitioner on board, we announce them on our social channels.
Mm-hmm.
They are listed on a provider directory that we host on our websites. And we do provide them with some content that they can use on their website.
Right.
That's been sort of, SEO optimized. You can take that for what it's worth these days with AI summaries and such. But just trying to give them the correct information to use to explain what a scleral lens is.
Right. And then they're implementing their own sales process.
Exactly.
Gotcha.
Yep.
And so that's a great addition. That's a great way to expand the reach. Mm-hmm. And now you can do it in how long did it take to expand to multiple countries?
So we've been. Was
that a difficult process?
Quickly.
Yeah.
It is. It can be. There's a lot of, with each country has their own,
standards.
Yeah. Like it's called CE, and you have to wait for all of these approvals and processes to go through. But we use distributors in other countries for the most part. Mm-hmm. But we are partnered with Moorfields Eye Hospital, which is part of the National Health Service in the UK. So they are manufacturing our lenses on site there. We are partnered with LV Prasad Eye Institute, which is a very large eye institute in India, and they manufacture our lenses, according to our standards there. And then we have a distributor that works with us through Latin America and some Middle Eastern countries.
Right. Wow. Amazing.
Yeah.
And so that cool. Part of that growth was since you've been on board with Boston.
Yes.
Yeah.
And my boss, who is the Chief Business Development Officer, she actually started 2 months before me. So the two of us really were like hand in hand working together to try to bring everything up to speed.
Yeah.
So we have a great relationship.
And so when you're, of course, marketing to the client and marketing to a business, it's a different approach.
Yeah.
And how did you navigate that? What was the way, and was the commercial already operational when you came on board?
It was operational. And it had been very much a sort of grassroots effort. I think the team that was working on it did a fabulous job because they were not marketers. There was an account manager and a product developer, essentially. But one of the things I did was I had mentioned this earlier, was audit everything that they had, materials, website. I looked at all the channels they were on. I think, the number one thing I tell marketers is reduce the channels where you're at because it's almost always too many. So I'm a marketing generalist and I have been my whole career, which I love. Sometimes I feel like a jack of all trades, master of none, but I like to see the big picture and I can connect the dots between operations, strategy, content, digital, etc. Mm-hmm. In small companies like BostonSight, you have to be a generalist. There's no getting around it. I can't spend my whole day working on email campaigns. And so in that case, you have to optimize efficiency. And that is key for reducing where you are and making the most of the channels that you want to be on. We found, we had a Twitter account. We absolutely did not need Twitter or X. Our doctors are in the clinic. They are not looking at their Twitter feed all day. So we reduced our social channels, I think, by half. We redid the website, always important if it hasn't been looked at in a long time. Even as a nonprofit, you have got to be directing people to your website. I've heard several times from folks that websites aren't that important, which to me it blows my mind. That's the place you need to drive people to get more information about you.
Exactly. Yes.
I consider it one of the most important parts of your marketing strategy. But Yeah,
it's really the destination. It's where else are you going to send them?
I don't
Right. I mean,
know.
like you got to send them somewhere. And
Yeah,
so the website is the perfect place to send everybody. It doesn't matter what channel you found them on, and you can send them from one channel into a very specific place on your website. I mean, it just seems ridiculous to not. Where
right.
else would you go? I don't understand. Would you
I
send them
don't.
to?
I was at a company prior that wanted to keep sending everybody to our social pages, and
Oh my
I
God.
think that there was somebody there who was really stuck on the likes that people
Oh
get.
no.
You remember
Yeah.
that
Okay.
phase of social media?
Yep.
Yeah.
Yep.
Um, so yeah,
Yeah. The
it
what
doesn't
they call
matter.
them, the vanity metrics.
Exactly. The
Yeah.
vanity metrics,
Yeah.
right? Pretty useless overall.
Yeah. Yeah. You can't sell anything on a like.
No, exactly. Exactly. So, yeah, so we reviewed all of that. And one of the things that I do, so I also manage our PR, and I still believe in press releases. I'm a little old
Hmm.
school that way. I know I've been
Yeah,
around a while,
I do too.
but I strongly believe in them, not more so for actually getting your internal team on board with what you're trying to communicate.
Hmm.
So when we were launching a new product, it was the best way to distill what the CEO, what the product developer, what the chief business development officer, and what I, from a PR perspective, thought were the most important parts. This is a great place to let everybody put in every thought they have, right? And
Right.
then you can weed it down to the most important points. Because if you start letting all of those other roles contribute to your brochures, your website copy, that's where you end up with. You ever seen that picture of the pizza with the turkey and the M&Ms on it, where you end up with something that's everybody contributed to and is absolutely meaningless.
Yeah.
So for me personally, I found actually letting them have the opportunity to talk about everything they want to in the press release. I'm not keeping it in the press release, because when
No.
it's there, though, they can start to see how muddy it is.
Right.
And they're like, okay, you're right. Let's pull this out, and then we can clean it up and get a better handle on what it is we're trying to communicate out.
I think that's a good point, because it's you're talking about you can't be everything to everybody all the time, and every
Exactly.
time you put out a message, you can't say all the things that we do and how great we are, and because you're not really speaking to anyone at that point.
Mm-hmm.
You're speaking to everyone, and then you might miss the person who you really want to hear the message may not hear it.
I'll tell you, nonprofits are notorious for doing that, because we're also marketing to donors, and they're like, well, everyone's a donor.
Mm-hmm.
Well, they are, but not everyone, not everyone's going to care about your cause, nor do humans have the bandwidth to care about every cause. If
Mm-hmm.
you give the right focus on the right people, you're going to be much more successful. We actually, for the first time, outsourced some of our market research to a small firm this year, and it was wildly helpful. One, they were able to talk with customers and non-customers of ours.
Mm-hmm.
And we thought that would be really helpful to have an outside company do that, so that people could really feel free to speak about what they thought about a BostonSight and our products and services. And the small company came back with a 75-page document showcasing all of our personas, what each area was looking for as far as like what they needed to maybe move the needle a little in this direction or in that direction. And, that's stuff we'd been wanting to do, but just
Mm-hmm.
didn't have the resources in-house to do them.
Yeah.
So that's also part of that, optimize efficiency, work smarter, not harder, is knowing
Yeah.
when to outsource something. That was a big lift for us. And they accomplished it in probably 6 weeks. It was incredible.
Yeah. It's an important thing you're saying, is that, you can't always do everything in house.
Mm-hmm.
Or as an organization, not only is it, you just don't have the capacity, or sure, it's a priority for a period of time, but if something else comes up, it's the first thing that gets pushed aside, right?
Yeah.
But it also, like you said, it gives a very objective, an outsource gives a very objective perspective, and they're
Yes.
looking at your company and your messaging from the outside in. Whereas when you're in it every day, all the time, you kind of are only seeing certain things. And I think getting that outside perspective is very helpful. It's really kind of gives you a fresh outlook and says, oh, I don't think I never thought of it that way, and sometimes companies do need that because they do get a little complacent in the way their messaging is going, and just having that little sort of like having a mirror shown at you to say, "Here, this is what it looks like,"
Yeah.
and it's great. It's very valuable. Yeah,
It takes the emotion out of it too. As somebody who'd been
yeah,
working on the messaging for the past 5 years, like the last thing I want to hear is somebody say, "Oh, that ad was absurd," or whatever. I mean, I have a thick skin; I could take it, but it's nice to have the emotion pulled aside and then
yes.
just get the results. So that's helpful.
Oh, don't tell a creative that though. They get very emotional when it comes
Yeah.
to that. I don't like that picture. That's not very good.
I know. And if there's one place where everybody in your organization has an opinion, it's on marketing, right?
Oh my God. At some point,
Everywhere.
everyone, it doesn't matter what level you're at, which position in the C-suite, everyone becomes a logo designer.
Yes. Yep. Or they say, let's just make the logo bigger.
Oh my
Make the
God.
logo bigger.
I think we have that on a t-shirt somewhere.
Yeah, you haven't really been in marketing until you've heard that and said to you.
Exactly. Particularly on the banner of the website.
Mm-hmm.
It must be bigger.
Mm-hmm. It's too funny. Oh, I love it.
Do you, a little on that note, do you find that, or have you found maybe in your career, not necessarily where you're at now, but where sometimes marketing is one of these things that's like, well, we got to have marketing, but that organizations or companies don't always align, because you mentioned strategy and planning and goals and all those things, that they don't necessarily align all those things with their marketing and sales, because sometimes those things get very siloed. You got a sales department and you got a marketing department, and do you find sometimes there's a disconnect?
Yeah, absolutely. I think some things that are really important is, especially from the product development side, you're trying to stay ahead of competitors or what's coming out. You want to have, of course, we think our lens is the greatest lens. It's an excellent lens.
Of course it is.
But there can be some features, for example, that, are wonderful. You have to take a look at how many people in the market would actually be able to use that feature. Right. So, for example, we provided a feature that required a secondary piece of equipment, which we learned only, in Latin America, 8 or so doctors had. And we knew this because we had talked to the equipment supplier. So is it worth the investment in time to try to introduce that feature into the Latin American market when only potentially 8 customers would be able to use it?
Wow. Yeah.
Right? No, absolutely
That's
not.
valuable information to have, eh?
Yeah. And so that's exactly where product development, marketing, and sales all have to be really talking to each other. Because we can market as much as we want, but do you remember the phrase, you can't put, it's like putting lipstick on a pig. Do you remember that phrase? Yeah. Not that our product was the pig. It was an excellent product. But if there's nobody to sell to, or it's just not a useful product, you can't do anything with that.
No, it comes back to the pigs don't need lipstick.
Exactly. They're beautiful the way they are.
Lipstick's better used somewhere else. That's more. It's a good point. That the departments need to communicate, and they need to know that, especially now. I mean, I get it. There was a time when a lot of these areas were disconnected, but now in modern marketing, everything is connected.
It is.
All the data is connected. And if your data isn't connected, if your sales and your marketing data aren't aligned, and your product information and your assessments of the market assessments, nothing's aligned and the data is not connected, you don't really know where you're going. You're kind of flying blind.
Yeah. Yeah, that's exactly right. We have so many tools at our disposal, even, some free tools, for nonprofits. I always remind folks as well that ask any software vendor or any vendor in general if they have a nonprofit discount. We do use Canva for some of our stuff, and we have a free pro account because we are a nonprofit.
That's great. That's great advice.
Yeah. Our CRM.
Nonprofits don't always know that. Yeah.
Yeah, absolutely. Our CRM system, we have a nonprofit discount. Like that is incredibly helpful for us. Because nonprofits, we still have to drive revenue, right? We can't have a business without revenue, but we are heavily mission focused. We're not reporting to shareholders, but our stakeholders are our board, they're our employees, they're the people that we are serving. And to be able to run a successful business, you have to have revenue.
Mm-hmm. Absolutely. And it doesn't mean to say you can't make more revenue. I mean, there is a bit of a disconnect to it that a nonprofit shouldn't make any money. But I think that's a fallacy. I think that's a bit of a myth. I mean, the more money you make, the more you can invest back into the company.
Yeah, exactly. We budget to try to come out as even as possible each year, but the more money we make, it really will go back to patient care because we do provide funding for patients who have financial need and cannot afford the treatment or the scleral lenses. So we provide quite a bit of that every year. And we do put it back again into product development and research. So it's a really nice place to be from a business perspective. Would I have liked to have made more money throughout my career and have stock? Sure. but my husband says he's an engineer. He's like, that's what he does. And he's like, I do the good work. And it is good work. I see it with all the patients we talk to. We have interviewed so many patients. They are all willing to share their story because they're so grateful for.
That's great. Oh, I'm glad you said that. So you use video testimonials of patients? Oh, yep. That's great.
We do. And actually, we just held our first patient webinar. We hadn't done this before, but for the PROS treatment, we wanted to provide an opportunity for people who might be interested in the PROS treatment side to learn just the very fundamentals of the treatment. So we had a patient speak. I moderated. We had a patient speak. We had our chief medical officer talk about the treatment itself. And then we had our clinic director talk about the logistics of getting a referral, coming into the clinic, how long the appointment takes. And that was really well received. And so that's an example of sort of that B2B2C marketing. So again, it's for advocacy purposes and ensuring that patients know what their options are.
Mm-hmm. Was that something you'd seen somewhere else and thought, oh, I'm going to implement this?
I don't know. It's possible. I can't think of what it was off the top of my head. I don't want to take credit for it necessarily. But,
that's okay. You can take credit for it.
But yeah.
I just thought maybe you had seen it or heard of it somewhere as an idea and thought, I'm going to try this. And it worked. You kind of just dreamt it up and thought, I'm going to do this. Oh, wow. That's great.
And because we had talked to so many patients that after we interviewed them and did a little video testimonial had said, I'm willing to talk to any potential patients you have. Just have them call me. And I think that's where the idea generated from.
Right. Yeah, that makes sense. Yeah, that's great. What other kind of things do you do that for marketing initiatives and campaign strategies? Other kind of, what else do you do?
Well, on the commercial side, we definitely do a lot of email campaigns and social. We still do print advertising and digital advertising. We had tried something that was a huge flop. I always love to share something that didn't work at all.
Oh yeah, I want to know the flops.
This was my genius idea. I decided that we should have a customer roundtable session that would happen a couple times a year, where we would invite all of our practitioner customers to this roundtable online, and we'd have identified somebody from our customer base who would kind of moderate the conversation. I would be there as well. But it would be an opportunity for them to learn from their peers, for newer fitters to ask questions in a comfortable environment, but also for folks that were a little more established to get some more experience, talking in a group setting, right? Because sometimes we reach out to these folks and they will present on our behalf at a conference. We provide them honoraria and such, but so it was a multifaceted thing. Well, I scheduled it, did all the outreach for it and the marketing for it. And I scheduled it at a time that most of the doctors on the West Coast would still be in clinic. And 2 doctors showed up. It was me and 2 doctors. And
awkward.
Yeah, they were wonderful. And they had the best conversation. So that was great. But after it was like, all right, this just did not work at all. So reassessed, and our team decided, let's try something a little different. And so we took that learning experience and thought, what did we really want to get out of this?
Right.
And how can we change it? So we moved it into a dine and learn session where we have our one of our account folks. She will actually go to a restaurant in a location that we have a lot of customers. And in advance, we invite all of our customers or our leads that are in that area. We cap it at 20 people. They get a very nice dinner. And it's a 2-hour combination of networking. So you're networking with all, customers, non-customers, experienced fitters, non-experienced fitters.
Oh, nice idea. Yeah.
Laura, our staff member who runs these, she does an hour presentation, and then there's time for Q&A afterward. And they've been really successful because it's really about that relationship building, but also helping the practitioners learn from each other. So those have been great. And we're on our 3rd one of those. It's actually taking place this week. And
oh, wow.
Yep. It's full up, 20 people. It's been a really nice group.
The in-person things are really making a comeback.
I 100% agree with you.
Yeah. People are really open now to getting back out and connecting with other people. And it was slow. It was slow to resurface, but it's kind of coming back. The trade shows are coming back. There's a lot of interaction happening now again, which is kind of good to see,
It's interesting you say that, because I've been thinking a lot about what the future of marketing might be, right, with AI and such. And I'm not worried about AI taking my job. I use it for some things. Maybe eventually. I worry about the accuracy of information that is going to be out there. We already see so much disinformation, but I'm also, you see these younger generations as well starting to pull away from being available on their smartphones all the time and looking for ways to be a little more analog. I think some of these more tried and true marketing tactics might come back. I think the pendulum might swing a little bit the other way. So it will be interesting to see how that shapes up.
Yeah, I'm glad you brought that up, because it is, I think you're right. Some of the older, traditional marketing activities or actions or initiatives are making a rebound again as well. Long form videos, longer reads, blogs and podcasting and video casting. So that the kind of, it's still information, but it's getting to people in a variety of different ways, but a little bit more traditional. I mean, podcasting more or less has become the radio of now, right? And so, we're just, everyone's paying the big distributors, podcast, Apple, whoever, instead of local radio stations. So, it's really, that's what this has become. But you got to choose what channel you want to listen to, what subject matter you want to listen to, which is actually really interesting. But it's just navigating that space and understanding how it fits with your organization or how it fits with your product. But again, like you said, coming back to being in person, it's really making a comeback as well, because I think people are missing that connection, that connection with people. I mean, we can do it here, you can do it online and it's great, but there's something a little bit more concrete in person.
Agreed.
Right.
Yeah. Even hard to read some social cues online, right?
Yeah. Yeah,
Yeah.
I mean, everyone's on, it's easy to kind of, plus you can watch yourself, right? So I can watch how I'm behaving at the same time while I'm talking to you, right? And so it's a little bit curated or maybe a bit contrived, but we're, and we staged the background, and, we're lit well, and, we kind of, it's not really in person. Like in person, there's a little more room for, to being more casual or being more familiar. So I think that's where people are really looking to reconnect in that sense.
Yeah, I agree.
So as far as innovation now, we've talked a bit about technology. What's next for BostonSight? Are there new products in the sight line? Excuse the
Well,
pun.
we just released a large upgrade to our online ordering and management system. We are one of the only scleral lens companies that allows practitioners to log into it's an online software basically called Fit Connect, and from there they can design the lens for their customer through a step-by-step process. Yeah, it's really wonderful. Many other companies still have folks email like paper or write on a PDF, a fillable PDF or something, and send it to the lab. But ours is all online, and we had spent the last year and a half upgrading this system. So that was a huge lift.
Wow, that's a big step.
Yeah,
wow, that's huge. Yeah,
it's been really exciting. We also have some new features for our lens that are coming out later this year that are pretty dynamic. But the CEO just released our 5-year plan. We'll be sharing that with folks soon, and that's really looking at how we can continue to grow around the world and how we can use things like AI or other digital technologies to improve the fitting process. We are also exploring how scleral lenses might be used as for drug delivery. For example, we did a research study with, I think it was, I don't know if I can say this online. I won't say the product's name because I'm not sure I can say it. Sorry, not
that's
yet.
Okay.
I don't know if it's still under wraps.
Mum's the word.
But using a dry eye drop in the bowl of the lens with the saline to put on the eye to improve hydration of the eye and to calm inflammation further. I'm sure lots of people have seen things about smart lenses, with digital technology with actually in the lens. We'll be exploring that.
Ooh, cool. Wow.
I know there's a lot of opportunity, but we also need to make sure we're focused on our core mission still, right? Which is improving vision and ocular health of as many people as we can. So, we also partner with a number of companies that folks can use a machine called an aberrometer, which maps the eye. Mm-hmm. And that can map something called higher order aberrations. So you wear glasses, as do I. Higher order aberrations cannot be corrected with regular contact lenses or eyeglasses. They're things like double vision, blurring, ghosting, halos you might see at night while driving.
Oh, okay. Yeah.
It really impacts night driving. And our lens has a built-in HOA correction system already. And there's like 3 different levels the doctor can choose from when fitting our lens. But sometimes the HOAs are so severe that what's in our lens is not going to work. And we're the only company that has this already built into the lens. So we're ahead of the curve there. But this HOA, this custom correction, uses the aberrometer where the doctor scans the eye and then sends that scan to the lab, and a custom lens is built to correct those HOAs. So that has been some pretty cool technology to work with.
That is very cool. Yeah. I heard something else recently too about eye scanning technology that can actually pick up a variety of health issues within the body as well.
I saw that.
Yeah, that's really interesting too. And you'll end up blending that together and then tying that in with your personal health data collection cloud portal, and then it continues as you, every time your eyes scan, it continues to load up that information. And then along with all your Fitbits and fancy weights scales, we're collecting data on our health and on a regular basis. And now we're not worrying about people getting to the doctors on time. That all that data is being collected and then crunched, and AI can then process it and ping the doctor, ping the owner of the health portal and say, hey, you've got something going on that wasn't there 6 months ago. You better go get that checked out.
Yeah.
A medical system built on prevention as opposed to reaction.
Which would be wonderful, right?
Wouldn't that be cool?
Prevention, yes. As long as insurance companies don't get involved and worry about, what could happen rather than what is happening.
Mm-hmm.
So that's the key.
Also, maybe insurance companies might be more interested in rewarding people for not getting sick. It could get turned around if they see the benefits of that. Yes.
Yeah.
Here's a reduction in your insurance cost because you lost 10 pounds.
Yeah, exactly. That would be a much better way to use that information.
Way better way to use it.
Much better.
Mm-hmm. Well, this has been awesome. Michele, thank you so much for spending this 50 minutes with me. It's been insightful, if for lack of for the pun, excuse the pun, but really great to learn about you and your journey in marketing in the healthcare industry. You've been really helpful. I'm sure listeners will have lots to take away from hearing you speak today. So thank you so much. Is there anything you'd like to finish with that we didn't touch on that you'd like to share?
Oh, no. If you are suffering from, ocular surface disease or corneal disease, I really encourage you to learn more about scleral lenses. Our website is BostonSight.org and BostonSightScleral.org. That's the commercial product. But in general, talk to your eye doctor about what options exist for you.
Yes, and mention to them BostonSight.
Yeah,
absolutely. Excellent. Well, thank you again so much, Michele, and maybe we'll talk again one of these days, I hope. And I'd like to hear more about where you go in the future.
Thanks, Heath. Appreciate it.
Bye-bye.
Bye.
I always enjoy talking to other marketing professionals in this space. There's a lot of things that we have in common, and yet there's things that we can learn from each other. And I think that's very interesting to do that. I like hearing from Michele, understanding that marketing strategies at BostonSight usually focus on education and outreach, which I think is happening more and more, particularly in the healthcare space. She also emphasized that the importance of reducing marketing channels for her effectiveness was very helpful. Another great piece of advice for organizations that feel like they're spread too thin, particularly in the nonprofit sector, and that websites are crucial for directing audiences to the valuable information that they're looking for, again, in healthcare and in nonprofit, which is where Michele's expertise really stands out. We talked a little bit about outsourcing too, which is also an important point to understand. When is a good time to outsource, and what should you outsource? It can provide valuable insight and also, expand your capacity to do more, and particularly in your marketing. In-person connections are becoming increasingly more important these days, and we're also noticing that more traditional marketing methods are seeing a bit of a resurgence in the digital age. So, fun conversation. Really enjoyed meeting Michele. I hope you enjoyed it too. Thank you for listening to the Healthy Enterprise podcast, and we'll talk again soon. Stay healthy and take care.